Hi, I'm Dr. Sandy Picken. I'm a guideline developer in the Knowledge Translation Unit at the University of Cape Town Lung Institute. We've developed a guide for health workers to use during a primary care consultation called PAC, which stands for the Practical Approach to Care Kit. In this short video clip, I'm going to introduce you to PAC, show you some of its essential features, and explain how we've developed it. PAC is not a textbook, but rather aims to be that single tool a health worker reaches for during a primary care consultation. Hence, its essential features are: it's comprehensive and simple to use, it integrates the approach to the patient with more than one problem, and its recommendations are practical and locally feasible. The first half of PAC covers 40 of the most common symptoms in adults, listed here alphabetically. The second half provides you with an approach to diagnosing and following up 20 common chronic conditions, ranging from infectious diseases to non-communicable diseases, mental health, musculoskeletal conditions, women's health, and palliative care. The main thing that distinguishes PAC from other guidelines and textbooks is the information is organized to reflect the way in which a patient presents to primary care. This makes it easier to access the right information when a patient presents with a symptom. Each symptom is arranged on its own symptom page. Check in the red highlighted box to see if the patient needs urgent management and immediate referral to another level of care. Then follow the simple algorithm to manage the patient who does not need immediate referral. The page may contain a reminder to refer the patient for further assessment if the clinician is unsure of the diagnosis or there is no response to treatment. When we look at the chronic condition section, you will notice that the chronic condition routine care pages have a standardized format. What to assess and when. Notice 3 tones of grey indicating history, examination, and investigations. What advice to give the patient, and what medications to prescribe. We've designed PAC to assist the clinician to address the concerns of the patient who may have multiple symptoms and chronic conditions which may or may not yet be diagnosed. The symptom pages prioritize identifying the chronic conditions covered in the second half of PAC, recognizing that many acute problems in adults represent episodes of poorly controlled chronic disease. And the chronic condition routine care pages prompt the clinician to consider common comorbidities. We have made this integrated approach practical, using arrows in the text to direct the clinician to relevant pages. Follow a curved arrow to the page indicated and return to the current page as there is still relevant information to consider. The straight arrow will lead you to continue on a new page as there's no need to return to the current page. We initially developed PAC for a South African primary care setting, drawing on the expertise of over 200 local clinicians and health managers and aligning the content to local policy and scope of practice. Color coding the medications blue, green, and orange to indicate the prescriber level helps to clarify which clinician can prescribe what medication for each indication. Then we spent 2 years checking each of PAC's 2,500 recommendations against WHO guidelines and BMJ's evidence product best practice to create PAC Global. We update the content of PAC every year to keep pace with new guidelines and evolving evidence. Our team can help to localize PAC to local policy and realities, like medication and test availability, prescriber levels, and referral pathways, making PAC a reliable, practical, go-to resource for every consultation in primary care.